Welcome, everyone. I'm Dr. Terry Hildebrandt, and I'm here with a esteemed panel of guests, and we're having our EBC Professional Series webinar called Coaching for Health, How Coaching is Transforming Healthcare and Wellness. And tonight we'll be hearing from Janet Ottersberg, Dr. Narir Umrani, and Lisa Perlman. They're all famous people who have been working in the field of healthcare, and they are also graduates and of the Fielding Graduate University. So they are here to talk about how they are using coaching and healthcare together. And we're going to begin with some brief introductions from each of our panelists. And I'm going to ask them to tell us about your journey of incorporating coaching into healthcare and wellness as an introduction. So I'm going to turn it over first to Janet.
Hello, thank you for having me. I'm very excited to be part of this panel this evening. So my journey into coaching started more than 27 years ago when I started as an occupational therapist. So I've worked as an occupational therapist in many different settings and with many different types of clients through the years. And one of the things that always came up for me in my work as an occupational therapist is that people were not reaching their goals. So the percentage of goals that I determined for people when I did their evaluation, they were not reaching. The percentage was smaller than I would have liked. And the thing that came up for me was that I was determining what their goals were. And when I went to OT school, there was a small piece in our education about asking the patient what they want their goals to be. But that kind of got lost in translation. And so in my journey through my career, I stumbled upon coaching because I was thinking about branching out into psychology or social work, and somebody led me to coaching, which was such a great next step in my career as an occupational therapist, because with my coaching practice, I then learned how to coach my clients into what their goals are and what health changes that they want to make. And so the percentage of changes are so much higher and greater when the client is participating in that process.
Great. Thank you, Janet.
Mm-hmm.
So let's hear from Lisa.
Well, hi everybody. I'm listening to Janet and I'm thinking of my own journey of probably close to 30 years in healthcare. Started out as a social worker. I got my master's in social work, and I think at the time I was kind of like, I liked the aspect of social work and working in healthcare in particular, but I was also really interested in the organizational side of things. And at that time, there really wasn't an OD world. But I really took a journey as a leader in social work in New York City, because that's where I'm originally from. I live out in LA now. And through my journey in social work, in leadership, I found my way over to HR because I really liked the aspect of leadership development. And it's particularly in healthcare, because what we were finding, and both as a leader in social work, but also when I made the journey to HR, was we had all of these great, brilliant clinicians that are working in healthcare and hospitals and institutions that are really not equipped to be leaders. They haven't really had that ability to develop that skill. And I found my way to coaching through my work in HR, and I have been able to do coaching, and then found my way to Fielding, which has been life-changing, really life-changing, and has been invaluable here in LA in my work at Children's Hospital Los Angeles, where I am, because now the appetite in healthcare for coaching is just, kind of been hit out of the park, because of, I think there's a lot of attention paid to, we have this, the clinicians working and taking care of sick patients and families. And we have not done a really great job of developing and supporting those people that are caregivers. And there's a lot of looking in the last 10 years, I would say, but really in the last 5 years, of how do we help our leaders support those that are taking care of people that are not well. And I've really been so fortunate in having the opportunity, both on being on the clinical side and now really getting to have a seat at the table with the leaders. And, my journey into coaching it's just the perfect combination. And I'm excited for the future, actually, at this point. So I'm excited to be here. Thank you.
Excellent. Thank you so much. So Dr. Marani, if you wouldn't mind, talk about your journey.
Yes, thank you for having me. Nice seeing you all. My story is kind of like a little unique. When I was, because I came from Pakistan, sorry, little background, to US, I had to start everything from the beginning, bachelor's, and then try to get into med school. Finally, I did. Then my friends were telling me when I was in last year med school that why did you choose this job, because you are gonna end up killing yourself. I'm like, what are you saying that? Because physicians have no life. Why you chose this thing? So meanwhile, while I was doing third year med school, I did master's in medical management as well, because I like the management part as well. So then I came across this coaching from Fieldings. So and then I'm like, I need to do something to coach myself. If I want to be a better doctor, not to be like my colleagues they're talking about, that they just they're miserable, the life is not good. I need to be a better person myself. So what can I do to make myself better? I said, you have to live by example. Where can I get the examples from? Get the coaching certificate. So I know what I have to do to make myself stronger, so I can be better for the patients, also for the administrative as well. So that's how I started the journey, and thank God it worked out very well for me, with wife and 6 kids, and now being a physician at the Navy, for the U.S. Navy, and I'm a director for the clinical department with one of medical schools. I'm handling my time keeping and my life keeping, my wife keeping, my children, everything in a way that I want to coach somebody else. So that's how it started. I never did it professionally for somebody else, but as soon as I finished my certificate, I had many of my colleagues approach me, and we talk, and I coached them without any fees or anything like that. So I've been doing that on temporary, appointment basis. But it helped me again. First, it helped me for myself. Now, when I'm coaching my other colleagues, it's also helping me to better myself in this arena of medical field. So I've been in the medical field about 10 years, and been in the management field about 12 to 13 years. So this is where I am.
Great, excellent. Well, thank you. So thank you all for the great introductions and how you're all bringing coaching to different aspects of healthcare, as physician, through HR and leadership positions, and Janet is a wellness coach, which is such an important and growing field. So I'd like to see how coaching has transformed your own work in wellness. How has that showed up for you as you approach wellness in your various ways?
I'll go first. To be a physician and seeing patients, and also doing the management part of the medical field, the time management, you have 24 hours in a day. That's all you got. You don't have any more than that. You're never going to stretch or become anything different. My other colleagues, when I see them, they get so much occupied into their physician and then their job, they forget to do their daily 1-hour exercise. They forget to do, like my wife and I, we married 29 years. I still do my Wednesday a date with her. I don't care how many kids we have or what we do. I don't want to stop that. Eating dinners with the family. I always want to do that. So what brought me is time management. In that 24 hours that we have, in there 8 hours you got to sleep and then take care of yourself. The other 16 of that you have to put into the world and your family. So balancing my life has been the biggest comfort from this certificate and all from this knowledge.
Excellent. Who'd like to go next?
I mean, I can jump in here as far as my own. I think you're talking about, the question was about our own wellness, and how we've used that in our coaching.
Okay.
Right.
Yeah.
I think for me, always, mind body is, you can't, be with, they're connected. And I've always been into exercise, and what I've really been able to, and I appreciate what that you were just saying about that, that balance between work life. That's a huge thing that comes up all the time, especially as the world has changed and everybody is 24/7 with their, with their cell phones, and they're, working all the time. And I think it's been a really important thing that I've lived by as well, is that you, especially in hospitals, it's 24/7, 365. You're going to have to create an off time for yourself. And that's been an important part of the modeling in the work that, I get to do in the hospitals and with the clients. And I find what's been really invaluable now is this introduction of really the wellness part really being welcomed into the corporate world and in healthcare, that it's okay for people to, like, even in the hospitals, having yoga, having, massages on site, all those things. And, I think that's something that I continually, do for myself and try to coach others in that way.
Okay, excellent. To Janet, thoughts?
All right. So for me, coaching has influenced my life and my work in so many ways. And as far as my work goes, coaching has influenced that, in that it's given me the confidence to go out and start my own practice. And so I have, as well as working as an occupational therapist in the school district, I also have my own practice of life and wellness coaching. And it's given me the confidence to integrate mind, body, spirit practice into everything that I do.
Excellent. Well, thank you. So next, how has your coaching practice supported other healers and leaders in healthcare and wellness?
I'll go, since I was the first in the round. I had a friend of mine, he's a pathologist, and one day we were just being frank, and we were talking about going to Caribbean for a vacation or something. He goes, I don't know, I need to talk to my accountant and see I have the allowance. I go, I don't want to take his name, I just call him Dr. John, for example. I said, what do you mean? He goes, yeah, he manages my money. I go, you telling me that somebody else, you were the doctor, you were working, you butt off, pardon my language, and then somebody else is managing your money? He goes, yes. I said, why is that? Because he goes, I couldn't do it myself. I said, you know what, me and you need to talk. He goes, he goes, okay, let's do that. So we got together and we set few sessions, and then we start talking and got some letters, got some papers and pens for him, start writing down everything and where money coming from, where money is going, how you can do what, and where you can put the saving. I mean, let him deal with it. I helped him open up himself. And within 2 to 3 sessions, he had to literally let go and fire the other guy, which he was paying $20,000-$30,000 a year just to manage his money. And on top of that, he kind of got control of his own finances. And happy since then, thank God. And we did the vacation together in Caribbean. And I was very, very proud of myself and him that helped him bring in something like that, best out of him. So that's my experience, one of them.
Great. That $20,000 would be a nice vacation, right?
Exactly.
That's great. Thank you. Lisa, Janet.
I mean, I'll jump into, I think that I've, what I've really found, especially in being in the coaching sphere at this time, has really changed and allowed me to be a leader in a different way, just in my own area in HR, where the hospital that I'm in, and a lot of you who know about healthcare, there's a lot of challenges financially for institutions, and there's a lot of change going on. And I think that, I've been really able to, through the coaching world, use a lot of what I've been learning and what I've learned to practice it with my direct colleagues as far as how to take care of ourselves during these very challenging times in change management, in particular in that space. And I think that really has resonated. It's helped me, through the stressful time. It's been a very stressful year in particular, and it's just really been helpful because I'm able to tap into a lot of the different aspects of how do we help one another. So I think that's been really great this year.
Excellent. Thank you.
So one of the doctors that I work with in my private practice, he's an integrative cancer specialist. And I started working with his office. They were looking for somebody to just give dietary and lifestyle recommendations to their clients. And they would send them on to me after they started with them. And I was going to be giving them those recommended changes. One of the things that I was able to offer to this doctor is that there's so much more to it than that, and especially with people with cancer. Because when somebody's given the diagnosis, a terminal diagnosis, and asked to make all these changes, there has to be the willingness to do that. And all the things that we learn in the coaching process leads us to help the clients to make those changes, and what could be life-saving changes. And so I had to educate that doctor on, it's not just about telling them they need to change their diet or they need to change their lifestyle, but about leading them through a coaching process in making those changes so that they want to make those changes and they can identify what the changes are that need to be made. So I think that was one of the biggest ways that I influenced somebody else in health coaching.
Great, thank you. So how has your own coach education and training contributed to your career? I know some of you have touched on this already, but if you'd like to elaborate or add any other details, we'd like to hear how this has supported you as a coach and as a professional.
As far as for me, right now I'm wearing two hats, one as a physician for the Navy and also the director for the clinical department, where I help third and fourth year medical students to manage basically their rotations, clinicals, all the way till they graduate. And one of the things I wanted to coach them was the bedside manners for the physicians. And I thought this would be the best place, the best time to help them now until, otherwise they teach them in residency, it'll be too late. So I've been hammering a lot that issue with my students. Help me, this professionally, so kind of like help me how I can coach them to do better in bedside manners when it comes to their patients.
Excellent, thank you.
I think for me, I wear multiple hats in the HR sphere. And one of the things, that again, I think I said that in the last question, but is really I have to make a lot of difficult decisions and sit with some of the leaders on some difficult decisions that need to be made. And I think with the coaching, it's really, again, using not as much as giving advice, but helping them see where they need to go next and what steps need to be made, as challenging as they may be. And I think I've just really gotten better by all the coaching work that I've been doing and some of a lot of the readings and work that I've been doing in the coaching program. And it's actually elevated the work that I've been able to do.
Okay, thanks.
Coaching has helped me in the process of initiating contact with my clients. So when I'm doing occupational therapy work, and as the other two said, I wear many hats as well. But as I'm doing occupational therapy work, The coaching has influenced how I talk to my patient, which then helps me get to that place of what is it that they want to see change in their life. And when they can determine that, then it's so much easier to then get them to make the changes that they need to as far as their healthcare goes. One of my other hats that I wear is an occupational therapist in the school district. And one of the things that's always very challenging in working with children in the school district is working with the parents and coming together as a team with the parents. And my coaching has certainly influenced how that process happens, and creating a relationship with the parents that's trusting as opposed to putting up barriers.
Excellent.
So I think those are a couple examples.
Great. Excellent. So what advice do you have for other professionals and leaders in healthcare or wellness who want to use more coaching in their work?
Learn to coach yourself first. You know, that would help me. So I'm trying to live by the examples for myself, my kids and family, and, you know, a family of coaching, you know, leaders out there. Yeah, learn to coach yourself first. And if you better yourself, you're managing time, you're managing your job, whatever job you're in, is this is where it starts with. So once you do that, then you can project that to other people and help others.
Great, thanks.
Just 100% agree with you. I think it's about, you know, actually walking the walk and not just saying it. Like, I think that there's a lot of what happens in healthcare. A lot of times the coaching is for performance. You know, someone's not doing well, so we're going to get them a coach, you know. And so I think that the most important thing is exactly that. What is it that you have? What is it that you're going to bring forward? If you really, do you really believe in the coaching? That's going to change how you work and interact with people. You know, so I 100% agree with you on that. I think that's the most important advice. Is that what you really want? Is coaching really what you want? I think the word gets thrown around a lot, and it's really teasing out, making sure that that's really what they're looking for. And sometimes that's not the case.
Yeah. I'm just curious to follow up on that. How would you know that coaching is a good fit? What might be some indicators that could help a client figure that out?
You're asking. I just had this conversation. Unfortunately, I have this conversation often where the word coach, like someone's really struggling as a leader, and they just want to throw a coach at them. Well, they need coaching, when in fact, I don't know if that's really what it is. And that's the hard conversations of, well, let's talk through how have they been managing? What's the performance like? What are some of the things that have come forward before we jump into the coaching realm? Because there is a lot of muddiness that I see, especially in executive in the C-suite, where it's just like, oh, she needs a coach and she needs a coach, when that's really not what needs to happen. So those are the honest conversations that we have.
Yeah, I'm just also curious, what other tools might a HR professional in wellness and healthcare bring to that situation?
Oh, there's the assessment tools, the 360s. Right now, the space that I'm in, we're all been trained in Enneagram, and that's a huge tool that they like to use. Even with that, it's what are we doing with the tool and how are we working that? And it's actually been really positive lately, because I think that there's a real look at, we do need to try to use these things to really provide success for the folks across the institution. Because if the leaders are going to be leading better, it's, you know, that the institution is going to be working better. So yeah, the tools are very important again, but what are we using them for?
Yeah, and we'll come to you in a second, Janet, but there was a question that came from one of the participants in the audience. What ways in which to introduce wellness coaching into engagements that are primarily focused on leadership coaching, as well as what kind of assessments do you use in helping clients to evaluate their wellness? So I think you were talking about assessments. I think that might be a good question next that we can build on. But before we do that, Janet, what are your thoughts here on advice you'd give to others in the healthcare and wellness field that might want to use more coaching in their work?
My advice would be to find a good evidence-based program. I feel like the background and the coaching education that I got from Fielding was excellent, and it really helped me to create a bridge between health and wellness and coaching. There's so many coaching programs out there, and there's so many health coaching programs out there, that I think it's really, really important to determine what is it that you want to be doing with that, and to find the right program.
Okay. I'm just curious, what do you recommend people look for when they're trying to choose a program?
Well, I think it depends on what your background is already. So for myself, having a background in occupational therapy, I already have that medical background. And so when I was looking for coaching, I was looking for something that was more specific to, life or organizational coaching rather than a health coaching program. But if somebody wants to work specifically in health coaching, look for one of those types of programs. And there's some that are specific for people that are in the healthcare field already. There's some for people that don't have any background in the healthcare industry.
Yeah.
So I think just be very specific about what it is that you want to do with that education.
Yeah, whether you're looking for a deeper coach development program versus some technical knowledge around healthcare. That makes sense. So going back to the other question, and Hank, do you want to come online and ask your question? You might be able to state it better than I could.
Can you hear me?
We do.
Okay, because I'm using phone along with, so my primary practice is leadership coaching, so working with leadership in organizations. And, as one of you mentioned earlier, a lot of times organizations will throw coaching at leaders when coaching may not be the primary issue in the moment. However, in all cases, whatever the reason is for the coaching, all leaders eventually come around to the challenges they're facing personally and trying to put their life together in a coherent manner. And I'm just trying to figure out, do you have any counsel for us who are leadership coaches on how to introduce the idea of wellness coaching? And along with that, are there assessments in particular that we could use to do that?
It's a good question. I'm thinking.
I have one that I use because I actually work a lot in healthcare myself. So while you guys are debating, oftentimes when I work with especially middle-aged clients, I will ask them to go get a physical and do a full workup. And oftentimes I will find that they haven't done one in years. And sometimes when they present issues for coaching, it really has to do with more health related. So I actually have a partner that I work with who is a physician that helps me with some of those more complex issues, especially hormone imbalances. I'm finding that's a really big issue for men and women. Women are a little more familiar with these challenges because it's more pronounced often. That men also, I'm finding low testosterone is rampant right now in middle-aged men, and they don't even know they have it. And I'm just enough aware to recognize the signs, and I will often have them go and get blood work from their physician to actually dig into these issues. And then we create a plan that includes some of those challenges and treatment plans. Not that I'm diagnosing, but I work with an MD who does. So it can be a really practical thing to support them in thinking about these issues more broadly. So I'm just curious, any of the rest of our panelists, use any other techniques, you know, and that might be helpful to evaluate health and wellness?
I think from a very low tech perspective, as far as assessment goes, even just like the balance wheel, and just looking at, you know, where are people off balance in their life? Because when they don't have balance in all areas, it's going to show up in the workplace for sure. So I think that's a really easy and low tech place to start from.
Great, excellent.
Terry, can you hear me?
We do.
Hello, Carol. In terms of assessments, one of the things that I particularly like about the Berkman assessment is the stress management pages, helping people identify what are the triggers that really put them in stress, and then being able to manage it, to figure out what they can do to mitigate that, to prevent it, but being able to identify what it is that's putting them in stress in the first place, what needs aren't being met. And that's, I really love that about using the Berkman.
Yeah, Carol, I would agree. I'm a huge user of the Berkman as well. I think that's an incredibly powerful tool, and definitely supports people in overall wellness. I would agree.
Yeah. The same with the Enneagram, you know, that where we have like the pinches, and it is very much about the holistic whole person. And I think it has been really helpful. But I like what Janet was saying about the life wheel, or the wheel and the balance wheel, because every conversation that happens is about the work-life balance and what people do to help with their stress. You know, that's a conversation that is pretty much in the assessment phase. You know, what do they do as far as physical? Are they physically active? Things like that.
Great, excellent. So we also, anyone else have any thoughts about this subject before we move to the next question? So we also have Flavio. Flavio, can you come online and ask your question about positive psychology?
Okay, can you hear me?
We do.
Yeah, okay, that was just a question on whether the panelists have worked with positive psychology and related instruments.
Yeah, I think I go on that one first. I was giving you an example of the pathologist working on the finances part. Positive psychology, we encourage that a lot in our children, so they would not get routed in the wrong direction and grow up to be criticize others and do a bad way. So we teach our parents to do positive psychology on them. But I believe it never stops. You do that until until the end of our lives. So even adults as well. So when I was working with my colleague who was having an issue with the money and everything, with how he was having a hard time, balancing his money wheel, is that I was trying to show him kind of like a light, the coaching light. Say, okay, what would be if you don't have to pay $20,000 to this guy? You do it yourself. What if you just write down what you need and what you don't need, where you need to spend, where you don't need to spend, and when you need to spend it. So anything in positive. So that is the positive psychology for us, as a coaches, and I believe that is one of the best tools we can use in our hand.
Absolutely. Yeah, I'm also a huge fan of appreciative inquiry, which is part of the positive psychology movement, but a specific way of managing change for groups and organizations as well as individuals. And I use appreciative inquiry probably every day in my coaching, and it's a purposely positive approach to change. So we may have to do a whole webinar on that at some point, because it's. But if anyone else wants to, I see a number of people nodding their heads here. You may want to speak to that, Lisa, yourself, and Janet, if you have experience using that tool.
Well, I mean, I think that just appreciative inquiry is just really so important through change management. I think, I've been using that in the past year because it really does give a different way of really turning around how people are looking at things and viewing things when things are stressful, and everybody's different. But it really has been invaluable, because it feels almost like simple. And, I know I've been using it both with my clients and then internally in my team, with my own team, especially through change management. So I absolutely love to continue to learn more about it as well.
Yeah, fundamentally, coaching is all change management.
Yes.
That's kind of all it is, really, in some ways. But that maybe more of a smaller scale, right?
Yeah. I definitely use appreciative inquiry on a daily basis, and especially working with cancer patients, working with families with kids with special needs, really helping to change that perspective on, what are the strengths here, what's good in this process, and create movement from there is so important, because it's hard to want to see what kind of changes you want to make when you've been crushed with terminal illness. And so it's absolutely necessary in that process.
Yeah. And for those online who may not have experienced appreciative inquiry, I'll just give you a 15-second tutorial. It's really taking the positives, looking at what has given life, and the first phase is discovering what works and what has really created positive results in the past. And then you dream what you could have in the future. So you create a very compelling vision of success, and then create a specific design for you to achieve that vision. And then lastly, create destiny through ongoing specific actions that you hold yourself and others accountable to really deliver on the vision. And it's an ongoing cycle of always discovering what works, dreaming big, creating a workable design, and then creating destiny. So they call it the 4D model. But there's a whole philosophy behind it, that ask for what you want as opposed to what you don't want, and really focus on what I would call the side of the coin, which is the solution side as opposed to the problem side of the coin. So that's a 30-second appreciative inquiry tutorial for you guys. So I'm going to also open it up to anyone else online tonight who might have another question for our panel or a comment. So if there are no other questions right now, I do have a couple of others. One is, where do you see healthcare and coaching going in the future? What do you see the next big step here in this space?
Me being a physician, I would actually have a little suggestion as well. For example, for your program, where I think should have some seminars or some kind of presentation for the physicians, physician groups, the internists, the hardest ones are working at the hospitals. They work, the nocturnists, and when they're working overnight, all night longs, they're working 12-hour, 13-hour shifts, and then they have to do their, paperwork. So it might be a good idea to introduce them more. I think a lot of them don't know. I came across myself just accidentally through one of my friends in Chicago. So I didn't know this, and when I do bring it to some of my colleagues, they go, "That's a good idea. I didn't know about it." So maybe a good idea to bring this closer. More actually bring coaching more into the healthcare is I would definitely introduce more physicians to it, physicians and nurses, because they work. I mean, every field is honorable and working best, but they work in a way that affects them personally. Because I see it myself personally, so I believe we should introduce more to them.
Yeah. Lisa, I'd love to hear your perspective on this, since you're an HR leader in this space.
And it's so funny, he just brought up something that's the reason I went into HR, but really why I want to be in the coaching space is just exactly what he said. And there's an appetite for it now, for sure, for nurses and for doctors and physicians. There's a lot of stuff happening in that space. But what my journey was watching, doctors and nurses suffer so personally in a very deep way of, life and death every day, and they don't even know it. And I think that, it just takes away a part of them. And then there's all kinds of other issues that come up for them. Depression, there's higher suicide rates, substance abuse. There's a lot of that has been there for years. And part of the whole wellness industry, that wellness coaching in particular, I think it's, like I said, there's a real appetite for it now. And I think I was sharing with you that right now where I am, the hospital wants to, we're creating a job of a wellness physician specifically to do the, help working with the physician, someone that has coaching ability and in that space. And so just what, doctor was talking about, it is so critical to be with the doctors and the nurses because of that. And it's really why I got into the HR realm, was because we have the employees and, doctors and nurses who are day in and day out expected to provide exceptional care to the patients and families, yet who's taking care of them, who's caring for the caregiver. And so that's been in the narrative as well now. There's other things that, it's not in the coaching space, but it's really what has in the wellness space is there's been, I don't know if anybody's heard of Schwartz rounds. That's something that was developed in the 90s by a gentleman who died, a lawyer who died, and he donated money for across the country because who's taking care of the staff that took care of him. And it's it's a time for them to for staff to talk about very critical situations that have happened to them in a very safe space, in an emotional way, not about what did we do wrong, what, like an M&M, something happened, how do we correct it? It was like, this was really traumatic and this is what happened, and people get to share in a safe space. So those things are out there now. And I think, like I said, there's just a real appetite, and it's time, and it's exciting to have that. But I think we really need to get more involved. And I like what he was saying about, really providing more seminars, more trainings, that kind of thing.
Yeah, excellent. I know my own work in healthcare has been focused primarily on physician leaders.
Mm-hmm.
And my experience with physician leaders is they, have very deep educational background in, medicine, obviously, and to become an MD or a DO takes many years of really specific training and education, and then they get thrown into leadership jobs, and they've never gone to MBA school or probably never even had a leadership class really. And then they end up having to try and figure all this out on their own. So, leadership coaching and executive coaching can really support a physician leader to
Mm-hmm.
really, move into that new role and deal with all the complexities of a political system that, is engaging in really leading an institution or working across all the different, stakeholders. So that's been my own personal experience and how coaching can really support groups, but thinking about coaching the healer, right, for their own wellness and having a personal wellness coach is interesting. I also just want to speak a little bit and to see if any of you have experience with this, but I work with federally qualified health centers, or they call it FQHCs. So they are largely federally funded clinics, which really are quite holistic in their nature. And they have started to have official jobs called wellness coaches,
Mm-hmm.
health coaches. So as opposed to immediately putting people in to see an MD or a dentist, they first meet with their health coach. And the health coach does a whole assessment, almost using the wheel of life and the wheel of health in their case, to see what's going on. When's the last time you've seen the dentist? When have you had any reproductive counseling? How are things? They do a whole life assessment as really a life and health wellness coach, and then they are able to direct them to the specialist that provides, and they create more of a coordinated effort to look at people's life more holistically. And that might include, alternative methodologies, that you might not consider normally as part of a clinic, but it's really taking a whole different perspective. And these are full-time jobs, the wellness coach jobs and health coach jobs. So I'm just curious if any of the rest of you have seen this trend that is coming up in the healthcare industry.
This is Keith. Yes, I have the whole medical home type of philosophy is taking root. I also just wanted to piggyback on your comments about physician leaders and what a stretch that may be for them. I think that part of what plays into that as well is that physicians, particularly of a certain age, are for the first time finding themselves employees. As opposed to being in their own practice, and there's all sorts of expectations that didn't exist where you can sort of be in your own wild west in a way, and now you're part of a large system, and some of that may involve leadership responsibility. Some of it may just be learning to be a good employee, which can be stressful if that isn't something that you've done before.
Interesting. Great. Well, thank you. Thank you, Keith. So we have a few more minutes. I thought it might be good to just wrap things up with some closing remarks from each of you, especially for anyone who might be interested in getting more involved in coaching. Maybe they're a physician leader or they're a therapist, like you, Janet, who's doing work in your own company. Right, or at least as a leader in HR who's bringing coaching into hospital environment. There's so many options, I think, for people to get engaged. But how might someone get started in this space to even figure out how they could, incorporate coaching into what they're already doing?
I think the number one way to get started is to go and have some coaching yourself. And if you've never gone through coaching and it's something that you feel like you're interested in, go and hire a coach and just see what that does for you. I mean, that made the world a difference for me.
Yeah, I'd love to hear your own experience just for a minute or two. How did coaching support you personally?
I was really burned out as an occupational therapist, and I had tried all these different things. I went and got trained as a yoga instructor and a massage therapist, and I was just kind of flailing about. And so I went to a coach, and it really gave me some direction as to where I wanted to go and why I wanted to go there. And that's when I really was able to make a change in my career.
Wow. And after that, you decided to pursue your own coach training? Okay.
Yeah.
Well, thank you for sharing your own story there.
Yeah.
So Lisa.
I think it just, depends upon what somebody is. If you really want to work with people, I think you really have to be interested in working with others. I think that, is somebody else talking, or do I hear? I think I hear myself. Sorry.
Yeah, I think I muted that line, so we should be good.
Okay. It's for me too. It was a journey and kind of a natural progression, but it really came from a space of, I've always worked with people, and this was really just such a great way of trying to guide others. And it's not like, and you're sitting side by side with them. I say it's almost like being in the passenger seat, allowing them to drive, while you're, just laying out what they're giving to you, basically. And so, I know I'm talking about coaching, but if anybody wants to get in it, I like what Janet said, get coaching yourself or take a course. I actually did a 2-day certificate program. in 2015, and I was like, because I really, really was like interested, and that really started my journey at that point. And then I moved to California, and the rest is here I am. But just see what's out there, and there's wonderful things that are available.
Great, excellent.
And I think it just can help anyone in any work that they're doing.
Great, thank you. Dr. Marani, any thoughts on what advice?
Yes, sir. Mine, started out as preventative because, like I said, when I was in third year and doing my surgery rotation, and doctor looked at me and goes, "Why you want to do this? We don't have life." And I'm like, why is he steering me in the wrong direction? Well, he's himself sitting there and doing it. So I'm kind of the kind of person who try to see what's going to happen 6 months from now. I'm like, this is the job, this is the thing I want to do for the rest of my life. I want to be a physician, but a physician tells me not to be a physician because they're miserable. So I need to find out how it is. So this is where I come across with one of my friends. Said, take a coaching certificate and you will learn a lot. I was like, you know what? That's maybe best way. I need to learn myself so I can be a better physician and better father, better husband in my life.
Great.
And that's how I came across. And so mine started as preventative, and it worked. The heavens for me.
Great, thank you. Well, thank you all. I really appreciate all of you coming tonight and sharing your own experiences and advice and wisdom with our listeners and for those who will be watching this recording afterwards. And thank you all. And I hope to see you on a future webinar and also hopefully at our conference. I also just want to share a little bit of information about fielding and how you can get involved, how you can continue to grow in this space if you're already a coach and want to learn more. Our website is just coach.fielding.edu. And from our coach.fielding.edu website, you can check out our blog. We also have an article that was just published today by Dr. Keith Byler. He's talking about why it's important for coaching in healthcare to be maybe a little bit different than other types of coaching and what might be needed to be an effective coach in the healthcare arena. So I encourage you to check out his blog that just came out. We also will be offering more webinars coming up. We do 2 a month. One is what we call the Evidence-Based Coaching Professional Series, which this webinar today is about. We also do what's called the Evidence-Based Coaching Thought Leaders webinars. And our next one is on using archetypal imagery to access deep wisdom in coaching clients. So Dr. Annabelle Nelson will be speaking. She is a doctoral faculty at Fielding, and her webinar is going to be on April 17th. So I hope you can join us, and that'll be a great opportunity to learn more about how you can use imagery in coaching. And then we also will be doing a second webinar as well in April, focused more on, let's see, I'm trying to find it. Where'd it go? Sorry, you guys. I'll talk about that one later because I'm not seeing it at the moment on this list, but you'll see all of these webinars as you check out our EBC blog. We're also going to be having a conference in May on May 10th and 11th called the Evidence-Based Coaching Conference and Alumni Reunion. If you haven't yet signed up, we encourage you to come out to Santa Barbara and join us for that conference. We have a panel of and a series of 9 different speakers that'll be covering everything from marketing and building your coaching practice to using assessments in coaching, also meaning in life and work, and then appreciative inquiry. We talked about that briefly tonight, as well as an update on coaching in China and using different measures in coaching and EQ. So there's a long list of different things that will be exciting and certainly useful in your own life as well as in your practice. So please consider coming out and joining us. It's only $425 for all of this learning, and you'll get 7 hours of continuing coach education units through the ICF if you're looking to renew your credential. That's always a benefit as well. So again, thank you all for coming tonight, and thanks to all our panelists, and we look forward to seeing you next month in our next webinar.
Thanks a bunch. It's been fun.
Thanks.
you.
Bye, everyone.
Bye.